Guys, after subscribing to this channel, please make sure that you also press the bell icon so that no notification, no new video of mine, any educational video is missed by anybody.
Good evening, guys. I welcome you to this class. And like I said before, the class is about Mullerian abnormalities, and I'm going to be talking about basically the Mullerian abnormalities classification system, because that's where the examiners love to confuse you. That is the place where they like to ask you questions where you can fumble and where you don't remember things and you confuse and jumble up. So in today's class, my aim would be to make these classifications easier for you, first of all. And most important, there are so many systems. Even when I was studying, I used to get confused which to remember, which to forget, and which one is more important, which one is recent and stuff. So I'm trying to, first of all, I'll try to impress upon you the most important, the one which has to be learned, and how to be learned, and what if at all you need to forget, which one is the one that you can let go, which is the latest one, which is the older one, and how to remember the classifications. Now, as far as diagnosis and treatment is concerned, I'll touch upon those topics as well, because questions have been asked on those topics as well. Short notes, 5 marks or so. But you do not need to know in length about those procedures. At your level, you're not expected to know all of them. But that being said, you should at least know the names, which I'll be mentioning in this lecture. So we have a long way to go, guys. Let's begin with today's lecture. And I welcome all of you into the class. So I begin with this, basically we're going to be talking about the diagnosis and treatment. And we start with the embryology part, just for those students who were not there in my last class, in which I spoke in length about the development of the female genital tract. Okay, since we are now not concerned with the external genitalia, we're mostly concerned with the internal one. So I'll be focusing on those aspects. I told you that the entire female genital tract, mostly when I'm talking, except for the gonads are actually the ovaries. They are nothing but the intermediate mesoderm. Okay, the gonadal ridge, which I spoke about, the gonadal ridge is the one which gives away the gonads, or the ovaries in females, the testes in males. When it comes to the development of the tubes, the fallopian tubes, the uterine fundus, the uterus body, and the cervix and upper part, upper 2/3 of the vagina. Remember, I'm saying upper 2/3 of vagina. They're all formed by the paramesonephric duct in the females. In males, the mesonephric duct is important, or the Wolffian duct is important. In females, the paramesonephric duct or the Mullerian duct is important. And this is the, by the joining of the two. You remember I showed you through videos, lovely videos I had, so many videos I had in the last lecture. So those two sides, now remember what I'm saying. Two sides, paramesonephric ducts, they come and they fuse with each other, and then with the urogenital sinus lower down. Again, two paramesonephric ducts, right and left, they come in between. They first fuse with one another, and then they fuse with the urogenital sinus. So this fusion in between is what causes the uterus and the cervix and the upper part of vagina and upper 2/3 of vagina. The lower 1/3 is formed by the urogenital sinus. That's all you have to remember. So the lower 1/3 of vagina, which has got a clinical significance when you're talking about, the arterial supply, or, the metastasis when it happens, especially the cervical carcinoma metastasis, you talk about upper 2/3 of vagina, not the lower 1/3, because embryologically they are different. Okay, so the lower 1/3 of vagina is formed by the urogenital sinus, and that's all about it that I wanted to revise. Now I take you up with the different classification systems based on, the fusion, how much fusion happened, how much uterus is formed, how much cervix is formed, what part of cervix did not form, what part of vagina was not properly formed, whether there was during this fusion a septum that remained, whether the fusion was incomplete, not properly happening. There are so many Mullerian abnormalities that take place. And being one of the branches being infertility, and ever since the advent of laparoscopy, and that to diagnostic laparoscopy, you have so many of these things coming up, and understandably so when you put a laparoscope inside the abdomen. So when you see retrospectively, neither the ultrasound is very diagnostic, nor is your HSG very diagnostic. But yes, laparoscopy combined with hysteroscopy together is almost 90% diagnostic of majority of Mullerian abnormalities. So there are now, I'm going to be discussing about 3 basic classification systems. Okay, all of you who have just joined the class, you've not lost anything because now the important stuff is starting. There are 3 main classification systems of the Mullerian abnormality. Okay, one is the American Fertility Society, the AFS, which is the the oldest one. I think we've been studying that before, and it's very old. And the only problem why these so many other classifications came was because this American Fertility Society, AFS, was not concentrating on all the different modalities of what can happen, what can go wrong in the fusion of the Mullerian ducts. So all these things were not included in that, and which is the reason why it was criticized to a great extent. And finally now ASRM, again, see, this was American, this is also American Fertility Society, American Society for Reproductive Medicine, ASRM, has now taken up the responsibility, and a recent 2021 classification system has just come, which encompasses almost 90% of all Mullerian abnormalities, which I know and I've seen so far, and which are there actually. Obviously, these people they research a lot, and they come out with these different kind of classification system. So one I've spoken about AFS, one I spoke about ASRM, both are American. Then there is one more system which is to be pondered over, which is European system, the ESHRE, the European Society for Health and Reproductive Medicine, or reproductive system is ESHRE. So ESHRE, in which what happens is that even this European society has come up with a classification system, and every country has their own obstetrics and gynae society. We also have one, but the whole world does not follow these norms. We are following the norms of certain specific countries for the fact that they've done heavy research on that. They've done very honest and very, long-term work in that. There is no fabrication of any detail, and they've tried to come up with these recommendations which are followed by the entire world, not just by India. So which is the reason why we're talking only about 2 countries, mostly America and the European countries. We do not have, the RCOG coming up with these different recommendations or classification system. We have, in fact, ESHRE coming up, right? So which is responsible for the Fertility Society. And that came up with a classification. Now, I'll show you 2 slides, one by one, okay? The classification is the same, but you tell me whether this slide or this slide, through which slide do you understand and remember better? Through which slide do you understand and remember better? Is it through this slide? It's saying the same thing. Class 1, there is segmental hypoplasia. It could be vaginal, it could be cervical, it could be fundal, it could be anything, but it's basically hypoplastic uterus, cervix, vagina, anything for just tubes, right? So it's class 1. Class 2 is uniconvey. But I feel this is a better slide for me to teach you. This one. Why? Because it's pictorial. You tend to remember better. Okay. So let's take up this first. This was nothing but a classification of the American Fertility Society, AFS. Okay. And here I'm talking about the class 1, 2, 3, 4 classification. And now please pay attention, because towards the end, we are going to have a quiz, and I would want all of you to participate. Be it right or wrong, just make your answers. I'll solve it with you, and we'll just compare with these slides whether we were right or we were wrong. So this can be your OSCE question, remember? So please pay attention and try to memorize it with me. So class 1, right? Class 1 in AFS. Now these 2 are going to get confusing, because once you remember AFS, suddenly will come European, and it will change lots of things. So I'll tell you the trick to memorize. So class 1 in AFS is hypoplasia. This is very proper, Class 1 there's nothing. Class 2 there is something. Class 3 there is doubling. Diadelphys biconjugate. And then starts becoming normal. Septate, which is almost normal. Arcuate, even more normal. And towards the end, some vestigial thing like DES, which is diethylstilbestrol related drug abnormality, which is a T-shaped uterus. So I'm just giving you an overview. Let's start with step by step. So class 1, nothing. There is nothing only. Okay, it could be vaginal agenesis, it could be cervical agenesis, it could be uterine agenesis, it could be just the fundal agenesis, it could be, the fallopian tube agenesis. The multiple type, any kind of agenesis goes under class 1. Finish? Then we go to class 2. There is something, at least there's one horn of the uterus, uniconvate. Okay, so uniconvate uterus might come with another horn, which could have a communicating cavity, which could have a non-communicating cavity, which could have no cavity at all, and there could be a no horn at all. So A, B, C, D. Remember that, because even that I'm going to ask you. To what A is, to B what it is, to C, to D. So to A there is both. There is horn and there is communicating cavity, which is okay. To B there is horn but no communication with it. 3, there is no cavity only. What communication are you talking about? And then 4 is no horn. Forget about cavity, forget about communication, right? A, B, C, D. So it's very simple. Class 3 is just uterine diadelphys. Now, diadelphys uterus and biconvate uterus, people have a lot of confusion, even I had when I was studying. It's very simple. Mostly just remember uterine diadelphys as two separate uterus. Two separate uterus with with their own cervix and with their own cavity, and totally different with their own tubes and their own things. So two different uterus. Okay, two separate uterus. Biconvate, the same two uterus, they are joined together. They might be completely joined or they could be partially, joined. In case of complete biconvate uterus, is that the indentation is a little more deep. It's almost like diadelphys, okay? But don't get confused, there's one cervix. Okay, they don't have a separate channel for cervix. Okay, biconvate uterus complete means almost the indent is like, it's like almost like a diadelphys uterus. But partial is like just hardly fused in between. Almost like an, arcuate uterus kinds. And then comes septate uterus, very common, very, very common. In infertility practice, you see it pretty often. Again, you have complete partial. So biconvate complete A, partial B. In the similar way, septate complete is A and partial is B. And then arcuate uterus, there is nothing actually in arcuate uterus. Slightly, the dome, the fundus is slightly more convex when you see through the hysteroscope. It's even in HSG sometimes you can see, but usually it is missed, arcuate uterus, or overdiagnosed. And then comes last, like I said, vestigial, don't see it very often, T-shaped cavity, and you'll not be able to appreciate also, even if it's a T-shaped cavity. So that's DES for you. That is diethyl stilbestrol drug-related problem. I think you have got something. So what did I tell you? It's easy to remember 3-4 stages. There's nothing. Stage 1, stage 2, there's something. One uterus or one uterine horn is there. Stage 3, there's doubling. And then start stage 4, 3 and 4 is doubling. And then 5, 6, and almost the uterus goes to normal. So this was about the AFS system, guys. Do not confuse. See it again and again. And remember, try to remember. I've, pasted these 2 slides on your, in my channel also for you to just go back and see it again and again. You can take that out in your mobile and you can check it out every time I ask you a question, because in that sense, I know that it will be like seeing it straight away, but that will just wire the connections to your mind. That's what my class is all about. I'm just trying for you to just wire the connection so that at least something comes out of your mind when this slide is shown to you in your OSCE exams.